the end of Hawks. Cancer disparities among Black, non-Hispanic men age 50 and up in Polk County, Florida. So what is prostate cancer? Prostate cancer is the most common cause of cancer among men in the United States and the second most common cause of cancer in men worldwide. This type of cancer is slow growing and the second most leading cause of cancer death in the United States. The most common cause of prostate cancer is adenocarcinoma, which is usually seen in almost 100% of cases. This type of cancer starts in the glands of epithelial tissue that line your organs. So how does prostate cancer develop? Cancer is due to the proliferation of abnormal cells within the body. In this case, would be within the prostate gland. High-fat diets lead to the accumulation of adipose, aka fat tissues, which can secrete numerous pro-inflammatory cytokines that can play a role in prostate cancer progression. Being obese is linked with a higher concentration of these pro-inflammatory secreting proteins, which have historically impacted the progression of many cancers. So if you're obese, you're more likely to get cancer. Who is at risk for prostate cancer? Risk factors for prostate cancer include genetic factors, age, and race. Black men have a higher incidence rate of prostate cancer compared to white men of the same age. According to Prostate Cancer, a review by Ray Chattery, Lynn, and Montgomery, the disparities in racial risk factors for cancer diagnosis are complex, but it's believed to mainly be due to the access of healthcare, quality of care received, and the presence of more aggressive cancer biology. And the genetic factors that they included were germline mutations that are involved in DNA damage repair, which makes sense. If you have a faulty DNA damage repair, you're going to have more proliferation of more abnormal cells. Prostate cancer is hereditary. If your father and grandfather had it, you are more likely to get it in your lifetime. The average age of diagnosis for prostate cancer is at 67. Treatment varies on factors such as the risk of proliferation of more aggressive cancer types, age, health, life expectancy, and personal preferences. Treatment can include active surveillance, radiation therapy, surgery, hormone therapy, immunotherapy, chemotherapy, and targeted drug therapy. Prognosis. Keep in mind, the average age of diagnosis is at 67. 95% of patients live past 1 year. 90% of patients live past 5 years. And 80% of patients live past 10 years. It's good prognosis. Okay, so now we're going to compare the demographic information taken from the 2020 census with Polk County in the state of Florida. The population is 725,046. The employment rate is about the same at 57%. The median income is lower in Polk County at 66,909. The poverty level is higher at 12.8%. The people without health insurance is lower at 12%. The average age is also lower at 39.5. The percentage of those who are 65 and older is also lower at 19.4, but the disability rate in Polk County is higher at 14.3. The percentage of those that have a bachelor degree or higher is lower in Polk County at 26.5 compared to 34.9. The percentage enrolled in K through 12 education in Polk County is higher than the state at 70.9%. But the percentage of those who are obese, the percentage of physical inactivity is higher in Polk County, Florida, compared to the state of Florida at 36 and 28% respectively. And the available exercise activities in Polk County is lower than the state of Florida. Polk County has 71%, but the state of Florida is at 87%. So for this one, I just wanted to give a visual representation of just the disparities that are present in Polk County, Florida. As we can see, the rate of physicians per 100,000 people is pretty high. It's about 260, but the rate of physicians per 100,000 people in Polk County is extremely low. That means that there's a higher percentage of people a higher physician to patient ratio, which means that they're going to have a harder time getting care in a more timely manner, which could exacerbate current diseases. And with that high uninsured rate, that can cause problems for the people of Polk County. Okay, so now we're going to get into the prostate cancer levels in Polk County versus the state of Florida. For the state of Florida, it is 103.1. There's about 15,000, nearly 16,000 cases annually. The recent trend is stable And the rising 5-year trend in incidence rates is about 0.6, so it's pretty low. Now, when we get to Polk County, the age-adjusted incidence rate per 100,000 is 115.2, which is a little bit higher. The average annual count is 579, but compared to the state of Florida, we can see that that trend is rising, which means we have a problem there. And the rising 5-year trend in incidence rates is 6.1, which is nearly 10 times that of the state of Florida. Okay, so I wanted to talk about the different prostate cancer levels within demographics in both Polk County, Florida and the state of Florida. As we can see from here, the population, no matter the different demographic, is pretty low if they are less than 50 years old. But as they get older, 50 and higher, the different prostate cancer levels go up, which correlates with an average age of diagnosis of 67. So there is a disparity between the white population between Polk County and the state of Florida. We don't have any information for the Alaskan Native population, but there is a presence of prostate cancer incident rates for Alaskan Natives and American Indian Natives in the state of Florida. The Asian population is pretty much the same, and the Hispanic 50 and older is pretty much the same. But there is a huge disparity in the Black population where they're 50 years and older. The state of Florida is a little bit under 600 at 528, but the Polk County incidence rates is 658, 38.7, which is 2 times that of whites and nearly 2 times that of the Hispanic population as well, which means there's a high disparity there. So, okay, so what are indirect contributing environmental factors? These are factors that don't directly result from one's actions, but situations that can affect the living status of an individual. So for genetically, it can include gene variants and mutations, chronic inflammation, endocrinological and metabolism differences between races. Some psychological behavioral external factors are the socioeconomic status of somebody, limited access to care, systemic racism, and the deep mistrust in the medical system, as well as stress. Stress can definitely be an indirect contributing environmental factor. Protective factors, which are ways that we can fix these, are decreased implicit bias within the medical system, creating safer communities, creating higher wages and education, and better healthcare access and earlier treatment across all demographics. So direct contributing environmental factors are factors that have a direct and immediate impact on health. So genetically, it could be family history of prostate cancer, the age of puberty onset. The earlier you hit puberty, the more likely you are to have prostate cancer because according to E. Giovanni et al., it correlates with a higher level of testosterone, which makes you more prone to getting prostate cancer. The androgen receptor structure can also be a genetic factor that can contribute to prostate cancer levels. Psychological behavioral external factors are if you live in a food desert where there's no fresh food available, just processed food. High car infrastructure, which means you're getting out and you are getting less exercise. Low accessibility to healthcare, which means you're not getting your regular checkup. So the issues that you might have that can be caught earlier are less likely going to be caught and fixed until they're chronic problems. And medical and social stigma. Protective factors, how can we fix these? Expand testing to earlier in life, more affordable and fresh food, more free recreational outdoor activities, and we should increase our walkability infrastructure in Polk County, Florida. Okay, so risk factors are characteristics or behaviors that increase the chance of developing a disease. They can be modifying, things can change, or non-modifying, things you can't change. Non-modifying factors for prostate cancer include genetics, family history, race, sex, and age. Modifying factors include if you eat a diet high in red meat and processed foods, if you have a decreased healthcare access, or low activity levels. What are protective factors? Protective factors are changes we can make to lower the risk for developing the disease. Some protective factors against prostate cancer include increased access to healthcare and prostate cancer screening programs at younger ages, increased parks and rec infrastructure, as well as the walkability infrastructure, decreased food deserts, and increased community aid and support. So I performed a SWOT analysis on Polk County, Florida. Current strengths are the Polk County Healthcare Plan offers those who are uninsured a way to get free reduced cost healthcare. We Care of Central Florida provides transportation to medical appointments at no cost to the patient. Lakeland Volunteers in Medicine uses certified medical personnel to volunteer and take care of uninsured people in Lakeland for free. Male Care on a national level provides national support and advocacy for males with prostate cancer. And September is National Prostate Cancer Awareness Month, which brings awareness to the disease through national campaigns and encourages testing. Okay, so our SWOT analysis showing some weaknesses. There is a lack of racial awareness tailored campaigns for prostate cancer. I've only just seen campaigns that say men need to get tested and nothing specific for different demographics. Black men have a high genetic predisposition for prostate cancer compared to their white counterparts. And there's also social factors such as age, family history, smoking, lack of physical activity, and obesity that can increase the risk of prostate cancer. If the person has a lack of healthcare access due to uninsurance or underinsurance, that could be a problem. Social stigma within the community and a high genetic predisposition to more aggressive prostate cancer compared to white men of the same age. These are some weaknesses that we have found in our SWOT analysis. Okay, so some opportunities for growth include we can partner with the Urology Care Foundation to bring more racially diverse information to National Prostate Cancer Awareness Month in September. We can increase support groups for prostate cancer in Polk County, Florida. Just because Male Care has one nationally doesn't mean that there's not a need for one locally. We can increase awareness of prostate cancer as well as signs and symptoms and when you should start getting tested. We need to lobby local municipalities to provide more parks and rec for the citizens of Polk County. We need to increase the availability of fresh foods and vegetables in the community. And we need to increase awareness of the Polk County Healthcare Plan for those who are uninsured, so that way they can get the healthcare that they need. Okay, so some current threats to progress that we can make on this program. Lack of funding that can prevent messaging from going out to needed populations, lack of compliance to preventative treatment plans, lack of support from local municipalities can prevent policy changes, so we wouldn't have walkability increase in local parks coming in. Lack of awareness to local free healthcare can prevent needed demographics from utilizing the program, and social stigma can prevent patients from getting needed support during treatment and diagnosis. Some suggested actions include partner with the Polk County Health Department to release a prostate cancer awareness campaign that includes race-tailored information for Black non-Hispanic men, partner with the American Care Foundation to bring more support groups for men with prostate cancer, partner with local hospitals to like Lakeland Regional Health to expand and promote information for testing at local fairs and community events, utilize campaigns to bring awareness to social stigma within the community and help break down barriers, lobbying local and state governments to bring more walking trails, parks, and other free recreational activities in Polk County, Florida, and partner with local food banks and grocery stores to bring more fresh fruit and vegetables to the areas in need. Where are we going to communicate our information most effectively? We should leave information at local barbershops, city hall, local health departments, hospitals, churches, grocery stores, on Facebook, and the local courthouse located in Bartow, Florida. Our focus should be leaving information at physical locations rather than utilizing social media, because we are aiming towards an older demographic who might not be as social media savvy or utilize social media as much as the younger demographics do. We can also utilize TV and physical newspapers to reach our target demographics. And we should also focus on leaving information that's more picture or infographic based with local community members to gain trust in our message. This is a sample flyer that I created to bring awareness to prostate cancer. The blue ribbon is the symbol of prostate cancer. Know the symptoms, frequently having to pee with urgency, leaky urine, having to pee but having nothing come out, and some ways that they could get tested and where they could get tested, such as physical digital rectal exams and PSA screens can get performed at any doctor's office. And also just reassuring them that they're not alone with this problem. This is an issue that many men have, even in the county, but definitely within the country. And this is one of my works cited pages. This is another works cited page. This is another works cited page. And this is another works cited page. And this is my final works cited page.